Welcome to our LinkedIn session today, COVID-19's impact on women's reproductive health and economic mobility. Thank you for taking the time to join. My name is Seema Jalaan, and I'll be your moderator. I'm the Executive Director of the Universal Access Project at the United Nations Foundation in New York. Today, we'll be discussing the implications of the ongoing global pandemic on disrupting access to family planning, information, and services, as well as to sexual and reproductive health more broadly, and what this really means for people's health and livelihoods now and in the future. Before we get started, 3 framing notes for today's discussion. The first is that women, especially women of color, are bearing the brunt of this crisis. According to Oxfam, they are more likely to be pushed into poverty, they are more likely to go hungry, and they are more likely to be excluded from healthcare. And globally, women are overrepresented in low-paid jobs that are disproportionately hit by the pandemic. And this is not to say that women are victims. Women are leading the response to COVID-19 in so many ways, and they also make up roughly 70% of the health and social care workforce. I think we can all agree that these roles are essential to the functioning of our societies, but they are often poorly paid, precarious jobs that put them at greater risk from COVID-19. The second is that the pandemic has undermined women's reproductive autonomy and their well-being, and in some cases, rewritten their futures. A particularly stark finding from UNFPA, and a representative is on our panel today. 1 year into the pandemic, UNFPA estimates that 12 million women have seen contraceptive interruptions, leading to 1.4 million unintended pregnancies. So when health systems falter, often it's women's needs that are first to fall off. And when financial systems falter, it's often women's needs that are first to fall off. And the last and final point is that these issues are connected. Women's participation in the economy and in public life is dependent on our bodily autonomy and reproductive freedom. Being able to make free and informed decisions about our bodies and having children and having access to healthcare is the foundation of a better future. It's how any of us build families, careers, and communities. And so we have a stellar panel today representing a variety of sectors, and I'm really excited to learn from each of our panelists and their institutions about how they're approaching these challenges as well as these opportunities and ways that we may collaborate more effectively. So we only have 1 short hour. We'll start with introductions from our panelists and an opening question and have a group conversation, and then really move to Q&A from our live audience today. Please remember to put your questions and comments in the chat on LinkedIn Live. So let's dive in. So let's start with 1 question for all of our panelists and use it as an opportunity to introduce yourself as well. And I really want to start with what works. So what's your best example of supporting people's access to sexual and reproductive health care, including contraception, in the context of the pandemic? And so, Anne, maybe I'll start with you, as I know that this has been a top priority for the Bill and Melinda Gates Foundation. So over to you, Anne.
Great. Thanks, everybody. And thanks to the audience who's joining us today. My name is Ann Stars. I'm the Director of Family Planning at the Bill and Melinda Gates Foundation. And so for us, our biggest success and biggest impact is going to be, of course, through our grantee partners. And what I'd like to focus on in particular is the issue of data, because without data, we don't know what's going on. We don't know where we need to focus our attention. So getting data and information, both quantitative and qualitative, is critical for targeting our public health response to this pandemic. So we've been supporting partners like UNFPA, and you mentioned the most recent study looking at the impact of the COVID pandemic on women's access to and use of contraception. UNFPA has also been actively tracking the global contraceptive supply chain and taking action to ensure that there aren't disruptions in the supply chain to ensure that women can continue to get access to the methods they need. We're also supporting at Johns Hopkins University, at the Gates Institute, the Performance Monitoring and Accountability Data Platform known as PMA, which surveyed women in the Democratic Republic of Congo, Kenya, Burkina Faso, and Nigeria in the middle of last year to assess their knowledge of COVID and then the impact that the pandemic was having on both their health, but also on food security, economic well-being, et cetera. Information that was very useful in shaping the government policy response. We've been supporting FP 2020, which is evolving into the FP 2030 initiative, which has developed an incredible knowledge platform so that countries can share their experiences, how they are responding to the pandemic, the specific crises or challenges that they're facing, and how they're addressing those challenges. So I think this kind of, as I said, the support that we're providing to our partners is resulting in some proactive ways to address some of these key challenges, Seema, that you have outlined. Thanks.
Thanks so much, Anne. And that's actually a really good segue. I'll turn to Mariarosa, who represents UNFPA. And I know UNFPA has been on the front lines, especially in humanitarian and crisis settings. So over to you, Mariarosa, about your best example.
Absolutely. So Seema, hi, everyone. My name is Mariarosa Cutillo. I'm the Chief of the Strategic Partnerships Branch at UNFPA. So my office actually deals with all private strategic partners. Let me just, Seema, summarize, I think the main success we had last year and the main lesson that we need to build on this year is that we have been quicker and smarter, and we have really worked very strongly to unleash the power of partnerships. So some specific examples already, Anne, as mentioned, we actually tried to act holistically on 3 fronts. As you know, we are the largest procurer of donated contraceptives globally, and we have a footprint in 150 countries. So we had to act quickly. And we had to act quickly, first of all, on the supply chain. And that has made us really smarter, particularly working with our partners to make sure that there was not major disruption in the supply chain. So, for example, I can give you some numbers. We have provided dignity kits to address hygiene, including menstrual needs for women, girls, and key population to more than 7 million people, and supported 50 million women and young people to access sexual and reproductive health services. This was the first, let's say, big area in which we acted immediately. The second one was actually to support health workers. As you said at the beginning, the disruption of health systems has had a dramatic impact. So we had to support our midwives concretely. And the third big, let's say, area in which we actually acted was what we call the parallel pandemic. So the pandemic of gender-based violence. I don't know if you remember, but last year, I think at this time, we released a study together with the Johns Hopkins University, and we projected that by 2030, if we don't act immediately on gender-based violence, we're going to have 200 million fewer cases averted of gender-based violence by 2030. This is a pandemic in the pandemic and requires an holistic approach. So again, if you ask me, we have become much quicker and smarter in working in these 3 big areas together with our partners, including with the Gates Foundation, and of course, with you, Seema, and UNF. Thank you.
Thank you so much, Mariarosa. And as you mentioned, it's exacerbated existing inequalities and just shined a light on it. So thank you for focusing in on those issues. Let me turn to Sameera, who represents the World Bank, and to shift a little bit and hear a little bit from the point of view of an international financial institution. Sameera, over to you.
Thank you, Seema, and good morning, everyone. It's great to be on this panel. I mean, it was unprecedented times in the world of in the ecosystem and the world of the World Bank. We are a development institution, but we're also kind of very bureaucratic. I mean, we have milestones when it comes to our projects, and the average project to be put together from the dialogue with the government to actually the effectiveness dates. This is our language. It takes about 18 months, and suddenly we found ourselves in an ecosystem whereby we have to deliver, and we have to deliver yesterday. So there was a lot of sort of reduction and detours and shortcuts into all of this. We put together more than 100 projects in about 100 days, which is really a stark contrast to what we used to do in peaceful times. However, this also meant that a lot of what we were caring for, especially when it comes to the reproductive health projects, had to actually sort of take a second back seat, like everyone else. So I think what I really stopped at in my role as the global lead on population and development within the bank system is this internal institutional advocacy. Like, we kept on talking to the task teams and saying, let's employ the opportunistic model by which we can use all of these service delivery points that used to deliver, contraceptions and antenatal care and all of these things to actually advocate for testing. That was before the vaccines, testing and contact tracing and advice and counseling and all of these things. But we were very cognizant of the fact that, I don't know if you've all seen it, I am sure you did. There was 3 scenarios published by The Lancet, I think, summer last year, which really painted a very, very dark picture of not just the contraceptive prevalence rates and the unmet need, but also the other I call legacy indicators and legacy issues. First generation, which is maternal mortality, under 5 mortality, and neonatal mortality. These are the things that we've spent a lifetime working on, and we were very proud of the gains. And we package all of this into what we call the human capital accumulation. So there was a real threat. But I think what worked as well is hand-holding all of these teams into what we produced with the gender group within the bank system. On what are the entry points? Let's sit down and talk about it within your project. So I think the advocacy within the institution was something that paid off at the beginning. Of course, not to undermine also the partnership with the larger international community, the UN system, the Gates Foundation, and many other bilateral governments. But this is probably my most important takeaway lesson from what we have to go through in the last 15 months. Thank you.
Thank you so much, Sameera, for sharing that. And it sounds like turned a ship on a dime. So thank you for sharing. So Claus, let's round out this question. Bayer's obviously a large contraceptive manufacturer, and you work in partnership with so many around the world. What's your best success story?
Well, first of all, I'm very delighted to join the esteemed panel here with the accumulation of a very rich experience in the field. So I'm truly delighted. Looking back into the pandemic and the way we cope with it, there's a few things that we pride ourselves with. So I think it is fair to say that the employees really have collectively stepped up to our vision, which is health for all, hunger for none. And that became obvious and surfaced in many various activities across the globe, from donations to volunteering, from opening our product libraries to find therapeutics against the virus, and finally has led us to become a vaccine manufacturer in the future, although we've never done that in the past. So provided the vaccine proves efficacious, we have agreed upon a partnership with CureVac to manufacture the vaccine and to provide other services. So the one thing when you look into family planning, however, is that we really can pride ourselves in saying we have been able to maintain the global supply chain despite many challenges that we have faced along the way. So, and it's a bit of a concern that I have in the current political debate, that I see that re-verticalization and nationalization of supply seems to be on top of some policymakers' agenda. So that's something I would be concerned about, because we have proven that even in a pandemic, we have been able to supply the medicines that people need. More specifically on family planning, I would like to look back to the ICPD 25 in Nairobi in November of 2019. Probably by the time we had not been able to imagine what would be ahead of us. By the time we actually committed ourselves to make contraception available to 100 million women in need in low and middle income countries by the end of the decade. And what we've seen since then is that even despite the pandemic, in 2020, we've been able to increase the number of women that we have been able to access by 2 million. So the very ambitious plan that we have laid out has not been disturbed by the pandemic. And that is something where big kudos goes to the supply teams. We've also, in partnership with the Johns Hopkins University, had the first full year of contribution to the Challenge Initiative to really uphold the downstream activities in low and middle income countries. And we are now in a position to also expand the portfolio of offerings of our products into the IUD space, which was something we've worked on for quite a while. So that's just a few things to underline that more than ever, we've been serious about the commitment, and that despite the pandemic, we're ready to do everything we can to meet the goals we have laid out publicly and to make the required investment in times of a pandemic. And with this, I hand over back to you, Seema. Thank you.
Thank you so much, Claus. And ensuring that women have access to the method of their choice is such an important element of it, as you mentioned. And Claus, do you want to take one more second to fully introduce yourself?
Yes, sorry that I omitted it. My name is Claus Runge. I'm the Global Head of Market Access, Public Affairs and Sustainability for the Pharmaceuticals division of Bayer. I'm headquartered in Berlin.
Great. Thank you again, Claus. So let's move to a group conversation now. And I want to actually zoom out a little bit and come back to Anne to talk about the main barriers that keep women from accessing contraceptive methods of choice. And I want to layer in a second piece of it too, which is that, as we all know, women are not a homogenous group. And there's multiple layers of discrimination that impact us, whether it's due to race or age or ethnicity, disability, gender identity, or other identities. And so if you could also add a little bit, Anne, about how you ensure that women in all their diversity have access to contraception. So back to you, Anne.
Great, thanks, Seema. Yes, women face, of course, many barriers in accessing contraception. The analysis clearly shows when we ask women in demographic and health surveys and other surveys, when we ask women who say they don't want to, who want to avoid pregnancy or want to stop having children, why they're not using a method of contraception, there are a range of reasons that are given. The most common reason often given is women's concern about side effects. So we actually face a significant barrier there in terms of the products themselves. So in terms of the Gates Foundation approach, it's going to be a major priority for the new family planning strategy that was just approved recently by the Foundation's leadership, is to focus in on contraceptive technology, R&D, research and development, to see if we can get methods that better address these concerns that women have about the health concerns and the side effects. And to come to your point, in doing that, we need to, while this sounds like it's a horrible term, we need to segment the audience and look at, there's a range of factors around women's age, women's marital status, their level of education, there's a range of factors that influence what kind of method is going to be right for them. One of the key factors that we rarely talk about in the family planning space, even though it is a very important issue, is the frequency of sex. So what method is right for a woman or an adolescent depends in part on a number of these characteristics. So as we look at the contraceptive technology R&D, we're looking at methods that can address the needs broadly of women of reproductive age, but are also looking specifically at what characteristics of women and what needs women have across their reproductive lifespan, across a range of socioeconomic characteristics, geographies, et cetera, to try and make methods that support the development of methods that are most appropriate for them. One of the things that I think COVID has really taught us is we've seen a real acceleration of a movement that was already in place before COVID hit, which is a focus on self-care. And for in the family planning space, what that means is methods that women can use themselves, can the sort of self-administered methods. And we are leaning in the R&D space on in that category of methods, looking at can we adapt existing methods or develop new methods that women can procure and manage themselves. So I'll stop there. Lots more to say, but I want to give others a chance to speak as well.
Yeah, thank you, Anne. And obviously, self-managed care gives women more options, but it also reduces the burden on healthcare systems.
Exactly.
So thank you. So let's come back to our topic of economic mobility, because part of what we are wanting to discuss is the sort of near-term implications on women's health and livelihoods, but also the long-term. So let me turn back to you, Mariarosa, on if you can share a little bit more about the implications for women who have lost access to a contraceptive method of choice during the pandemic. What are the implications for their economic livelihoods and mobility? And then given your role at UNFPA, the role of partnerships in addressing this.
Yes. Well, I think, Seema, this is really what we call the integrated discussion. So access to family planning, access to sexual and reproductive health and rights cannot be considered as isolated from the economic impact, from the economic access for women, from welfare. So what we're looking at now is really a holistic approach to communities. I think I saw last week the World Economic Forum has released a new report around the gender gap. The impact of COVID-19 is probably going to lead to 135 years of delay in achieving the gender gap. I think that's the figure that they're giving. UN Habitat released a report about the holistic impact of the COVID-19 on the gender gap and gender disparity in all human settlements. So one of the key messages that comes out really strong is that now more than ever, we need to concentrate on leaving no one behind. So the type of work we're doing with our programs is really looking at the overall dimension of women and girls, making sure that the economic dimension is taken care of. For example, we look at how the local supply chains, and I'm talking about economic supply chains and value chains. I'm talking about small and medium enterprises led by women, how women can be economically empowered to have access to sexual and reproductive health and rights. So this is a key, let's say, growth in our programs. And this is very important, again, if you think that we're active and we have a footprint in 150 countries. Anne mentioned data at the beginning. That's also another key point of our strategy. We have a data dashboard on our website that you can visit. It talks about really the impact of COVID-19 on the disruption of health systems and on all our 3 zeros, including gender-based violence. So I think that's important to have data and at the same time have strong and holistic, let's say, programmatic impacts. And then I wanted to go back to what Claus was mentioning at the beginning, and which I also should have mentioned, which was the Nairobi summit last year. In 2019, 2 years ago. And that's where public and private partners made very clear commitments to the sexual and reproductive rights agenda. We need to make sure that there is accountability. We work with Bayer. We keep track of the implementation of the commitments, this has a very strong political value for us. And this leads me to the last part of your question, the value of partnerships. I believe that now more than ever, partnerships need to be smart. I'm using again this adjective, need to be smart and impactful. We need to send a message very clear here now. This is not the time to shrink public and private resources for human rights in general, but in our environment for sexual and reproductive rights. There is a risk, of course, we don't hide behind a finger. There's a risk that those resources are going to be shrinked. So that's why we really need to build, and I think Sameera mentioned at the beginning, ecosystems of partners. We need to build value chains of partners, public and private. And we need to make sure that when we talk about innovation and creativity around these partnerships, that innovation is again clever. It's innovation that allows us to address our bottlenecks. So only with these ecosystems of partners, where every partner comes in with a clear role and responsibility, I don't believe in unclear recipes. I'm bringing this example. I'm Italian. I talk about recipes, but I don't believe in what sometimes are wishy-washy situations where everybody does everything. This is a time to be really focused and to come together in complementarity with our specificities. And I think, I'm glad we have here today many of UNFPA's partners. This is the effort that we're trying to make. This is how we're trying to make partnerships smarter and better and more impactful. And this is our next step, but it's not only one next step. It's a series of next steps that we need to undertake in this direction.
Thank you, Mariarosa. I mean, you made the point so clearly. Every sector has a role, and no one sector can do it alone, right? And this is why we have such an awesome panel today showcasing different sectors. And I want to come back actually later on the next steps question. So thank you for teeing that up. So Sameera, would you also want to address the World Bank's findings on impacts on women's economic mobility? And then also the role of the development finance community in reinvigorating market access to contraception. Over to you, Sameera.
Thanks, Seema. And I am going to approach this from a reproductive health point of view, not just the family planning, and I'll focus on the family planning at the end. So when it comes to the economic hardship that were inflicted on population segments, and especially women, I mean, there is no negating that women are at the forefront of that burden. I recall one of my professors saying, if poverty would have a face, it would have a face of a young woman, not just any woman, but a young woman. So if you look at the population cohorts that were badly affected by the pandemic, you will find that it's older people, and we know that women live longer than men, so there is a lot of women in that population cohort, and these women usually are dependent on others for care, for finances, for mobility, for everything else. There's also the female-headed households who are poorer than the poor, you know, women who are working in formally or informally, and they have to make ends meet by, you know, supporting their families, and those are also hardly hit by this. The care economy had been discussed, but I just want to stop at it for a couple of sentences. I think the best example we have seen over the past 15 months is the health workers, the health force, especially the frontline workers, you know, nurses, and there are a lot of women within that population cohort, and these women also have to care for kids who are out of school, and perhaps more often than men have to care also for aging parents, what we call the sandwich generation, you know, women who are young enough to have kids and old enough to have aging parents as well. So that care economy is really very unfairly disfavors women when it comes to all of this. And also, the issue of GBV was mentioned extensively since we started, but I also wanted to add another dimension, which is really, and we've seen this in the Ebola crisis, which was not long ago. This issue of sexual exploitation and harassment. Women sometimes had to exchange medical advice or vaccines or testing for sexual favors, which is really the worst of what you can call into that spiel. And finally, let's not forget about the fragility, conflict, and violence settings, which unfortunately are. I mean, think about a pandemic in a refugee camp. I mean, circumstances are already very dire. They are less than optimal, and everyone is trying to, maintain that level of service that was it took a long time, and it took a lot of efforts and a lot of financing to establish. And then suddenly a pandemic hits, and you don't know where to start again. And especially when it comes to reproductive health services, pregnancy and antenatal care at that point in time is not only seen as a second or a third priority. It's seen as something that, natural, and it happens to everybody. And I don't want even to open the bag of worms on the contraceptions, because it's really taken as something that's not needed. And all of this, if you put it together, really hits hard at the women ability, at the women agency, which is really a pillar into picking where and when and how many kids this particular woman or girl would want to have. So I mean, the dimension of the economic mobility and the economic independence is part and parcel of all of these choices that have to do with women agency. Thank you, Seema.
Thank you. And I'm so glad you mentioned, Sameera, the context of fragile and humanitarian settings, because that's a crisis within a crisis. And as you said, and UNFPA says this all the time, pregnancies, periods, they don't stop in a conflict or a crisis setting. And so they have to be considered essential healthcare. Thank you for that reminder. And Claus, I know that it's your organization's bread and butter, partnerships, right? Working with governments, with civil society. Could you share more with us about the power of partnerships in addressing this, and the approach of your organization, and these linkages between sexual and reproductive health, rights, economic mobility?
So just let me for example, pick up the last point that Sameera made around humanitarian crisis. And we've seen awkward situations in many refugee camps. And that's why we, for the first time, want to address humanitarian catastrophes in a more structured way and add a family planning component to it. That's why we've reached out to the Red Cross. And we are now working on them with intense resources to help them set up emergency supply chains on the one hand, and to secondly train volunteers who can help out in refugee camps. So that is something which is also accelerated under the impression of the pandemic in last year. So actually, for the first time, that we are working so closely with this organization. On another note, I share the concerns Mariarosa has shared around, let's say, the pressure the donor community is under. Right, we've seen a lot of industry nations also injecting lots of funds into the local economies to cope with the crisis. So I hope that this is not leading to shortages on the commitments that have been made on the family planning side. That would really be a pity, given all the numbers that we've heard today, from unintended pregnancies to a widening gender gap. So that is really something I would call for, that the efforts are not being diminished or watered down in the years to come. As a private sector, I think there is also a responsibility outside the areas where people are donor dependent, right? So in many markets, in many countries, you have also in parallel private markets, and the way we as a company address is with pricing flexibility, so that we really stagger and tier prices according to the local income levels, and we've expanded that in particular under the impression of the pandemic across our portfolio, including contraceptive methods. So we have to acknowledge that there is not only a income gradient between countries, but also within countries that make it necessary for us to have at least some level of private market which is sustainable and resilient. Last but not least, I think Mariarosa also mentioned an important point of accountability, right? So the one thing we've done with regards to the 100 million challenge that I referred to earlier was we anchor our milestones to the 100 million to the boards and leadership remuneration. So our board members and our senior leaders in the company will be measured against this 100 million challenge. So by as of 2024, year by year, we have a governance system in place to check in whether the interim targets have been met. And I think that will help us also on the long run to also keep the tension and pressure within our own organization, right? Which is super important, but because you can always experience ups and downs, not only as a government or society, but also as a company. But that is really a helpful tool for us to really make sure that this is a sustainable long-term goal that we work towards.
That's really interesting, Klaus, and it's the first time I've heard of an accountability measure that's so inwardly focused. Thank you for sharing that. And it also reminds me of a report that UNFPA put out a few years ago when you were talking about pricing flexibility, that if you live in poverty, you are more likely to not have sexual and reproductive health care or experience your rights. And if you don't have sexual and reproductive health, you are more likely to live in poverty, right? So thank you for unpacking some of the diversity here in terms of women's access. I want to take a moment to remind our audience that the chat is open. If you want to share questions, comments, we'll be coming back to you in just a few minutes to hear from our live audience. But before we do that, just another round of questions, and I'm going to open it as a group question, is really this piece around next steps. What now? We've all been personally, institutionally grappling with the last year and the whirlwind of the pandemic. But as the dust begins to settle, how are your institutions thinking about next steps? And Klaus, maybe I'll just stay with you because you started already talking about that forward-looking commitment. So I'll come back to you and then we'll do a round.
Yeah, first and foremost, it's really 2021 is a year of massive investment into our family planning manufacturing network globally. So we will share the details towards the middle of the year. We have approved a massive upgrade of the production sites in order to cope with the increasing demand that we want to supply. So that is an important issue, and we have to acknowledge that there is some delays when you think about approvals for construction, regulatory pathways. Administrations are really overburdened also with the pandemic situation. So we really want to make sure that everything is in place in time, and the investment decisions are made and will be done. So I think that's the most important one. And then the second one is really the expansion of our product offerings in the contraception space, including IUDs that we are ready to offer to supranational institutions. So that's another very important thing for us. We will continue our financial commitment to the Challenge Initiative, which is geared towards the largest informal settlements worldwide, and really encourages local communities to take action in family planning offerings. That's another keystone, a key milestone for us this year to expand this commitment that we've already made.
Very exciting. Thank you so much, Klaus. Let me go back to Anne. Anne, you mentioned that the Bill and Melinda Gates Foundation has a new strategy on family planning. And so if you want to share more about that and your next steps.
Great. So in terms of, maybe I'll start with talking about, we've talked a lot about the devastating impact of COVID, and I by no means want to downplay that, but I think one of the things we're looking at as we look to the future is there are some opportunities and some innovations that have that a number of players have implemented as a result of COVID and to try and deal with the impact of COVID. And so one of the things we're looking at is what can we do and what can our partners do to try and sustain or even expand some of those innovative approaches. So looking at offering mobile services, telehealth, modifying clinic procedures so that women can have greater access to family planning and in fact in delivery care as well. We haven't talked a lot about that, but the impact of COVID has been particularly devastating, I think, on the maternal and newborn health side. We know there are a number of countries, Kenya, India, Senegal, have issued new guidelines for reproductive health that have increased access, have allowed providers to dispense a 3-month supply of contraceptive, for example. In some countries, in Uganda, boda boda drivers were delivering contraceptives to women's homes during lockdown. Philippines and Pakistan have launched telemedicine offerings. So looking at whether we can assess the impact of these kinds of innovative approaches and if they are effective, which the preliminary data indicates that they are, to expand and make these kinds of policy changes that increase access more permanent. I think I just want to touch on some of these, link this to the broader issue of women's social and economic well-being, and just to recognize that women in particular, as others have talked about, have suffered from the impact of COVID, that women make up 70% of the world's health workers. They've faced enormous personal risk to care for COVID patients, that women in many countries make up the significant majority of informal workers. They have been particularly devastated by both the lockdown and the economic downturn that have been the result of COVID. So really needing to think about these, taking that gender approach and looking at policies in both reproductive health, but also more broadly, the economic empowerment and gender equality policies that will take these kinds of impacts into account. So we're supporting, coming back to the Gates Foundation strategy specifically, I already mentioned the focus on contraceptive technology R&D, on looking at supply chains and market shaping to ensure that products get out there. We're also looking at innovative approaches like direct-to-consumer, expanding the availability of methods through pharmacies and drug shops, and addressing some of the social and behavioral barriers that limit access because of gender inequality, gender discrimination, so discriminatory social norms. What can we do? What can our partners do to address some of those barriers and increase access? So testing these innovative approaches and then working with partners like UNFPA, World Bank, Global Financing Facility, WHO, the key bilateral donors, to scale up these high impact practices, post-abortion, postpartum family planning, delegation of task sharing with community health workers. And then one of the issues that I'm particularly interested in is we know that mass media has historically had a huge impact on increasing, or significant impact on increasing demand for, and then therefore utilization of, family planning. I think it's a really interesting question around whether digital platforms, social media, can have that same kind of impact as print, television, and radio have had in the past. So that's one of the areas that we're going to be looking into in terms of the next phase of our strategy. Thanks.
Thank you so much, Anne. Yeah, there's a lot of discussion of, is social media the new kitchen table? So we'll see. Thank you. Let's go back to Sameera. Do you want to share a little bit more about what's next as you've built all these new projects and what's to come for the World Bank on these issues?
Sure. So there's a huge commitment, of course, from the leadership at the bank on combating this. This is the biggest public health endeavor we've ever had to come across since the creation of the bank. So money-wise, we've doubled our commitments from 6 billion to 12 billion. We have, at the request of our Board of Governors, shortened this IDA cycle to 2 years because we wanted to jump into the next one. And the IDA papers usually go into priorities, and one of those priorities is the human capital, which includes health, education, and social protection. Most of the additional financing, that's the round 2 of the MPA, the multi-phase approach that we have towards the pandemic, is focused on building back better. And I think this discussion is never complete without really looking at what the Global Financing Facility is doing. The strategy refresh is focused on restoring all these essential health services and going back to the gains that we've made as an international community in most of the indicators of the sexual reproductive health. Within the teams themselves, we've managed to create this really positive internal competition by which the projects come under scrutiny when it comes to the gender dimension, the essential health services, the women empowerment. We have a gender strategy that we all subscribe to that was issued in 2015, and it talks about first generation issues, legacy issues, and talks about looking forward. So I'm looking at my laptop right now, and I have all of these sticky notes. I have Sierra Leone, Senegal, Niger, Mauritania, Ghana, Congo, and Malawi. Project documents to look at, just to make sure that there is actually a gender dimension into it, which is really a step forward. And there is a lot of appetite for this kind of work within the bank teams. Anne beat me to it on the digital health platform, but we're really putting a lot of resources and a lot of thinking, because this is not only a cheaper way of doing things, but it's also more secure way, not just to do things, but also to collect data out of it. Of course, we are very mindful of the digital divide. Not every corner on earth actually would have that infrastructure to go to. And finally, I think this is the story of the pandemic and its impact on gender in general. Women and girls and boys and men is still unfolding. There is so much that we need to do. For example, we still have very little information on what does it mean to vaccinate pregnant women. What does it mean for a woman to be pregnant right after she gets vaccinated? What is the impact of the vaccine on young children and that relationship with opening schools and providing more opportunities? So I think the story is unfolding, but I think there isn't a better time for anchoring and cherishing those international partnerships, working with everybody who has a stake into this and has something to contribute. Thank you.
Thank you so much, Sameera. And actually, there's questions coming in on some of the things that you've said. So we're going to come back to you, especially on the data points and the long-term implications. But before we do that, Mariarosa, please share from UNFPA your next steps, and then we're going to go to questions from the audience.
Yes, thank you very much, Seema. I think there's, as I said before, a series of next steps, because we really want to have this holistic approach and learn from the pandemic in this COVID-19 reset. This is a very important time for UNFPA. We're designing our next strategic plan, 2022-2025, and it's a landmark plan because it will basically be 5 years then to go to the 2030 milestone of the Sustainable Development Goals. So there are a few mistakes that we can't make, because already we risk to delay the achievement of the 2030 agenda, and we need to be very pragmatic. So being pragmatic, one of the main things we are looking at is accelerators, and partnerships is, of course, one of the accelerators. Smart partnerships, as I said, to build ecosystems of partners. So this is the first thing we're looking at. And then on specifically the 3 zeros, there's 3 things I wanted to mention here. And I think Claus mentioned the humanitarian context. Of course, this is one of our priorities. But one thing we don't want to, let's say, forget is that this pandemic has thrown the world in a sort of global humanitarian crisis. The report I was mentioning before about human settlements makes this dramatically clear. So there are, of course, different priorities. There is a set of priorities on humanitarian crisis, but let's not forget about that. So this is also another, let's say, focus of our action. And then just on gender-based violence, one of the results of the work that we did last year was that in 87% of the 150 countries where we operate, gender-based violence has been included in the COVID-19, let's say, response plans at the country level. So 87% is a very nice, it's a very interesting number. It's very high, but we need to follow up on that and make sure that beyond being included in the country plans, there are actions that really move this forward. So this is one of our priorities, the gender-based violence piece. And of course, going back again to percentages, the family planning piece and access to sexual and reproductive health has been included in 84% of our countries, of the countries where we operate. Also on that, we need to move forward in a very streamlined way and real quick. So again, just to summarize, we want to make sure that the spotlight on the pandemic and on its impact on girls and women is kept high. And we do that, and going back to the importance of media and of the general public, and we do that also throughout a number of reach partnerships with our partners. Thank you.
Thank you, Mariarosa. It reminds me again of that Oxfam report, so aptly named the inequality virus, where they noted that it's the first time in recorded history that every country on Earth has increasing inequality at the same time. So thank you for lifting that up through UNFPA's efforts. Let's turn to questions from the audience, and we have several. Let's go back to the data piece that both Anne and Sameera brought up. And one of the questions that came in from Clayton is, what are the difficulties you're facing with gathering the right kind of data you require for your strategic initiatives? And has COVID made collecting data more difficult? So Sameera, Anne, whoever would like to start.
Sure, I'll jump in. Yes, we've seen delays in the data collection for evaluation and monitoring of a number of our grantee projects and initiatives. We are trying to pivot. I mentioned earlier the PMA data collection platform, and I mentioned the surveys that it had conducted in 4 countries in sub-Saharan Africa to assess the impact of COVID. We were able to do that at the height, really, of last summer of the COVID lockdown because we had mobile telephone numbers for the many of the audience, the respondents that we track through that PMA data collection platform. It's a longitudinal survey, meaning that we go back to the same people, and so it was also really helpful because it enables us to assess changes in key indicators over time as a result of COVID. That's not always feasible, of course, and obviously doing home visits, which is the standard methodology for many survey data collection, has been compromised during COVID. I think we're seeing worrisome trends in a number of sub-Saharan African countries. We're seeing significant increases in infection rates in Ethiopia and Kenya, in India as well. So we'll have to see what happens with these trends and whether there will need to be additional lockdowns in these countries, as there already has been in Kenya, for example. There are innovative ways to use, and Sameera would love to hear more from you about this, to use digital platforms to try and collect data. My concern about that is how representative is this data, right? You have to factor in that you're only accessing then data from a limited and in general better off segment of the population when you use digital platforms to collect data. But there are brilliant people out there who can figure out ways to adjust the data collection and estimation methodologies to take some of these factors into account. But data it's essential to understanding what is the scope, and understanding the scope is essential to figuring out the appropriate solutions.
Absolutely. Thank you, Anne. Sameera?
Hi, I'm not sure I can add anything to what Anne had eloquently said, but I just throw in a couple of thoughts. The first thing is that I mean, data is never enough wherever you go, and especially in pandemics, and because it really sort of abstracts the ways we can go and collect data. Even in normal DHS surveys, I'm a physician, and I don't want to sound like one in this discussion, is that I have a lot of difficulty with male surveyors talking to heads of households who are male about unmet need for contraception. I mean, it just doesn't happen. And I get that, women bodies will always remain an ideological battlefield, but at the same time, we're cracking numbers here. It's not, we're not talking about principles. So that's one thing. For the bank, since the beginning of the pandemic, we really depended on estimates rather than hardcore data. Of course, intelligent ones. It's not just something that, you sit in a corner at your laptop and come up with a number. And we also relied on partners. I mean, we really tapped into any database that has numbers that we could crunch into a model and act on it. The Johns Hopkins, the IHME, things that UNFPA had been doing, especially with the strategy refresh of the GFF. So all in all, it is not something that is optimal, but it's also the best we can do. And the digital platform has always the digital divide. We have seen a lot of data collection coming up from the unusual suspects, countries not necessarily low income, but middle income and a bit above, that are being, sending us all sorts of data, which we didn't think it was possible before. But I think the question of the numbers and the data is bigger than this discussion, but it remains really either a push towards everything else, like we're looking at the messenger RNA technology and the COVID vaccine to apply it to other very chronic diseases like malaria, for example. And this is not just about hardcore numbers and data, it's about something that's been around for a very long time, except we didn't really think about putting it to use, except that this pandemic really pushed us to do so. So it's all of this, the dynamics between the pros and cons and how we can make the best out of what we have in terms of information. Thank you.
Yeah, thank you, Sameera. I mean, these are such private matters, and so I don't think anyone wants their other partners or family members to answer on their behalf. So thank you for just bringing in the human aspect of it. We're running swiftly out of time for just one last question, so I'm going to turn to Mariarosa and Claus to comment on this last very good question, is how has COVID-19 impacted last mile delivery for reproductive health? And then a related one is it possible to reverse some of the implications in the ground that we've lost because of COVID? So really big questions. You have maybe 45 seconds each. Who would like to start?
Should I start, Claus, and then you are, because this is one actually of the discussions we're having with Bayer, on how to make sure that, again, we learn from the pandemic and we make the supply chain smarter and really reach out to the last mile. So one thing that we learned, it seems very concrete and simple, but that talking more and having, let's say, a more constant relationship on the ground and also globally with our suppliers is something really important. We tackled this crisis together, and that was really something that helped us avoiding a major disruption around the supply chain. So I'm trying to answer both parts of this question. So yes, working directly and concretely with our suppliers to avoid that we disrupt and we don't reach out to the last mile. I think that's what we're doing with Bayer, particularly in the humanitarian scenario.
Yeah, thank you. So I have to say I'm a believer. Yeah, I'm a strong believer. And I really believe that if we all go into a stretch, we can catch up a bit. Yeah. And that's what we need to work towards. And it may also be the little things that make a difference on the ground when you think about family planning units. So we've seen in some geographies that the volunteers working there couldn't free up their time any longer to go to the centers and advise women because they had to contribute to the daily income of their families. So in reaction to that, we talked to the local partners and we moved opening hours into the very early day hours or the late hours. for them to kind of patchwork their day in a way that they could make it and provide some offerings. I think we all need to have this flexibility and this innovation in mind that Anne also referred to. I think there is a wealth of innovative solutions and also digital solutions which have really mushroomed and emerged in this pandemic. And we should really carefully select the ones where we believe they can close the gap. So I'm a believer.
Thank you, Claus. What a great way to end. And, I think this theme of smart partnerships came through loud and clear. Well, thank you to all the panelists and to our audience for joining this conversation about sexual and reproductive health and rights, and really talking about it, about what it is. It's essential healthcare, and it's a human right. So thank you for lifting that up. And, for anyone who has lost access to a contraceptive method of choice, we know how high the stakes are. And that's what we tried to uplift today. So I'm really excited about these ideas. I hope it's just sparking more energy and more commitment to delivering for girls and women around the world, supporting their health and rights. And that concludes our session. Thank you again, and please take care.
Thank you.
Thank you.
Thanks, Seema. Take care.
Thank you.
Real pleasure.